Hi, it's Dr. Bloom. I want to talk to you about the in-office liposuction that we are now offering here at Bloom Plastic Surgery. In-office liposuction is small volumes of problem areas such as back of the arms, maybe a small area in the lower belly, the fat in the bra line, or even in the neck, as well as other areas such as the medial thighs. At Bloom Plastic Surgery, we are combining those procedures with our radiofrequency in-mode system, so AccuTite, FaceTite, and BodyTite, for patients who have mild to moderate laxity that need skin tightening to give us the best results long term. Question that we get commonly is, will you be sedated? Well, you will not need IV or general anesthesia, as we don't offer those here in the office, but we do offer and recommend that patients on a case-by-case basis take oral sedation, which is something that increases your anxiety, such as Valium, as well as a pain medication to help you with the initial pain of the procedure. But you'll be awake, you'll be able to talk during the procedure, and you'll be able to go right home from here with somebody driving you home. What areas can be treated? Well, we reviewed that in brief, but any small area of fat can be treated. We like to stay under a certain volume of fat so that we can safely do that here in the office. How long will it take? Well, that depends on what areas we're treating and what surgeries we are combining it with. We typically tell patients for a very small area or one that we're not combining with our radiofrequency system, it can take up to about an hour and a half, to longer procedures about 3 hours. Now, the reason for the difference in time is if we're combining multiple modalities, we may have to layer those treatment patterns, as well as we go very slow because you're awake and we want to make sure that you're extremely comfortable during your entire experience here. What will recovery look like? Well, the initial part of recovery requires, in most body areas, to wear a compression garment. That helps remove the swelling from the initial procedure, and that compression garment is worn for at least a month, sometimes a little bit more. It's worn 24 hours a day, 7 days a week in my practice for the first 2 weeks, and then we decrease it to 18 hours and 12 hours respectively over the third and fourth week. If patients notice that they're swelling during those off hours, we ask them just to put their compression garment back up. All the incisions are closed with absorbable stitches. So while there's still suture removal, you'll still have follow-ups with me at the office so we can review your results and make sure that you're doing all the post-operative care that you need to. How long will results take to see? Well, liposuction in general takes about 3 to 6 months to see our final results. If you're adding radiofrequency like BodyTite, FaceTite, or AccuTite, that will typically add about 3 months to our time frame. So 6 to 9 months before we're seeing our final results, and sometimes up to a year depending on the procedure performed. Doesn't mean that you're going to have to wait 6 to 9 months to see any results. Any fat that's removed and debulked, we'll see some immediate results. We see results within a few weeks once that swelling is settled out. But these procedures do take patience until you're seeing your final result that we can be very happy with.